Pascal, and I am a chiropractor here in Cary, North Carolina, director of the Pascal Health Institute. I specialize in treating people with CRPS, and I hold a weekly Facebook Live. So, welcome. And today we are going to talk about CRPS and neurologic pain. Obviously, if you know anything about CRPS, you know that pain is the major component of this horrendous disease. You cannot even chart the pain on a regular 1 to 10 scale. Many people are using a 1 to 20 scale, where 20 is defined as you cannot do anything that raises the pain, the perception of pain above that once they're at a 20. So they can be at a 20 and you can hit someone with a hammer and it's still at its max. It's at a 20. And because pain is the major presenter, the major issue for people with complex regional pain syndrome, it's in the name, that is what most people, most providers, most doctors address. They are addressing the pain, and in Western medicine with medical doctors, they address pain with painkillers. If painkillers don't work, they use different neurologic tricks like spinal cord stimulator or TENS unit, or even try cutting the nerve with nerve ablation, or turning off the nerve chemically with a nerve block. If you're a physical therapist, acupuncturist, chiropractor, then all those fields have various approaches to pain. Chiropractors will try to make an adjustment and reduce the irritation of the pain nerve. Acupuncturists will be doing a similar thing with needles. Physical therapists might be using different modalities that specifically address pain or the pain nerves, like a TENS unit that I mentioned earlier. The problem is none of these are very effective. For about 20%, a very small portion of the people with CRPS, you can directly address the pain and lower the patient's pain. For the other 80%, that's not going to touch it. And even for the 20% where the pain is going down, usually it takes something very, very drastic to get that pain to go down and stay down. And what this tells me is that if you're addressing the pain nerves and the pain isn't going down, then the pain nerves are not the problem. They are part of the problem. They are a symptom of the problem, but they are not the major issue, because if pain nerves were the major issue, or the pain part of the brain was the major issue, then these medical addresses of blocking the pain signals would lower a patient's pain that has CRPS, and that is not what is happening. And this is what led me to develop my method, the Pascal method, for CRPS patients, and that is a multifocal approach. What I have found is, yes, of course, the pain nerves are being fired. Yes, of course, the sensory part of the brain that is perceiving pain is being fired, but that is not all that's going on. People with CRPS have a major immune system problem. They have a hypersensitivity of their entire sensory part of their nervous system. So those other nerve fibers like light touch and vibration and temperature and location, all of those are overfiring as well. And we have a mental emotional component involved, because of course with all issues there's a physical component and a mental component. And if you do not address all of these things, if you only focus on what can we do to desensitize this person or lower the firing of their pain nerves, you're not going to have success. And what I have found over the last 20 years is that by addressing a patient's immune system and making it stronger, addressing the entire part of their entire nervous system, the parts that are going to organ function, the parts that are going to the muscles, and then the other sensory nerves that we mentioned earlier, testing all of those and resetting all of those with various techniques like lasers or different treatment modalities like piezo wave, arc wave, cold laser, frequency specific microcurrent, all these different modalities that help to normalize neurologic function. That is very important. And then of course that mental emotional component. In my office, we have machines like the NeuroSage, Brain Tap, specific gems, specific frequencies with our photon generator from Germany, which is very similar to a Rife machine, to balance that emotional component. And I also work with people outside of my office in the mental health field that I've vetted very thoroughly and know that they consistently are able to help support my patients. So if you have CRPS or you know someone that does, and you are seeing people that are only focusing on the pain component of the complex regional pain syndrome, unfortunately, it's been my experience that you're not going to get great results. And this is a dangerous thing for two reasons. One is you're probably having unnecessary nerve surgery. Or unnecessary surgery. I've never seen someone that had nerve ablation or some of these other nerve blocks and other nerve specific therapies. Sorry, I just kind of had a mental glitch there. But I haven't seen those patients get relief. I haven't seen heavy drugs like ketamine give any long-term results. And so if you are in a position where you're looking at putting potentially dangerous drugs into your system, getting unnecessary surgeries, a lot of those things cannot be reversed. The damage that is done from those cannot be undone quite often. That is a dangerous place to go. And then the other component is that CRPS is a progressive disease, right? It spreads and it worsens. It will typically start just in one limb. Let's say someone sprained their wrist or they broke a bone in their foot, but then it spreads to that entire limb. It'll go to the other limb. It'll go, if it's in the legs, it'll go up to the arms. If it's in the arms, it'll go down to the legs. And then eventually it'll be full body. And that is a very, very difficult condition to come back from. So I encourage all of you, if you are on this journey to find the right care, please reach out to my office. You don't have to come here and be a patient. Let me help give you some advice from all of the experience that I have. I'd be glad to do what I can to point you in the right direction. And of course, if you would like to come here, that's what I spend my day doing, is helping people with CRPS get into remission. If we have any questions, we'd be glad to take those on this live. If not, then, and you're watching this delayed, you can always ask your question in the comments section below, and myself or my staff will be glad to get back to you. So I wish you the best in your healing journey, and I will be back next week in the same place.